The COVID-19 pandemic has shown that a large proportion of patients remain asymptomatic throughout their course of infection, a proportion of which will develop mild symptoms and even smaller proportion will develop severe illnesses. However, in view of the large numbers of infected persons, in-hospital care for all symptomatic patients would result in rapid clogging of health facilities, resulting in unavailability of hospital beds for patients who actually are in need for hospital care, as is being seen in other states in the country. The Government of Meghalaya has taken an initiative of mobilizing home-based COVID-19 management in order to avoid unwarranted hospitalization and to make hospital beds available for all who actually requires a more specialized in-hospital treatment.
Meghalaya, being a small state, with our limited resources in terms of hospitals and manpower, will not be in a position to treat all symptomatic patients who become COVID positive. However, as mentioned earlier, a large number of these COVID-infected patients will not even require much of care. So based on this principle, the government has come up with a model where symptomatic COVID patients who have mild and moderate symptoms can be treated at home.
This model of home-based COVID-19 management aims to shift the site of clinical care for COVID-19 positive patients with mild and moderate symptoms to the comfort of their own homes. This will aim to set up a system where patients who have symptoms may progress to a more severe form of the disease identified early and referred to a hospital. The objective of the home-based COVID-19 management is to save lives by identifying a sick patient early, making hospital beds available for sick patients, and to save lives when hospital beds are no longer available.
This home-based COVID management team, it is piloted in Shillong agglomeration only area. This is a pilot project we have started in Shillong agglomeration area.
The home visits are made based on the alerts received by medical officers from the department. These visits are made specifically for positive symptomatic patients registered on the toll-free number 14410. The home visits are conducted by a team of staff nurses in which a self-isolation kit is being provided to all the patients during the visit. The staff nurse during the home visits will update clinical information and symptoms in a web-based application on their cell phones for further follow-up and electronic records. This mobile team will monitor and remain in contact with the patient till he or she recovers. Should the symptoms progress, a set of health indicators will be followed up and hospital referral will be arranged for the patient. These home visits are being monitored closely by the medical officers in charge of each zone. The specialist doctors are also available on call if the need arises for further advice and consultations. The home visits are planned between 10 a.m. to 5 p.m. daily. The staff nurses and medical officers are available 24/7 on call telephonically for any follow-up and advice. The medical team are being monitored very closely by designated nodal officers of the health department.
So I urge all my friends to stay home, stay safe, wash your hands, wear your mask, maintain social distance, and most importantly, get your COVID-19 vaccination done as soon as possible. And we should all remember that we need not panic, as most of the patients who get affected by COVID-19 remain asymptomatic. A small number will require some form of treatment, and it is our duty to make sure that hospital beds are available for patients who need them the most from among the ones who develop severe symptoms.
We hope the home-based COVID-19 management model will provide patients at home with the confidence and reassurance that certain forms of the disease can be well managed inside the comfort of their own homes, resulting in efficient referral to hospitals when required and preventing late presentations.
I would request you, please cooperate with us. The helping hand will really help our beloved patient in the state who has gone through this trauma. Thank you very much. Kublai Shibun, Mithila.